The following portion of Daytime Tri-Cities is sponsored by ETSU Health. Once again, it is time to meet your provider with ETSU Health, and today I'm talking with Pediatric Surgeon Dr. Brad Feltis. Doctor, appreciate you taking some time with us today.
Thanks for having me.
Let's talk about pediatric surgery. We're talking about working on the smallest of patients.
Yeah, it's such a blessing being in pediatric surgery because we can work and we do specialize in really small patients, even down to weighing just a pound or even less than a pound. But we also take care of children through adolescence up into their teenage years where they're starting to be more adult size. So that's one of the really neat things about our field is we have a big spectrum of patients that we care for.
I've got to ask, when you talk about small children, what's the smallest child you've performed surgery on?
The smallest child I personally have performed surgery on has weighed 350 grams, which is about 10 ounces.
Wow.
So, yeah, it's pretty amazing. We can operate, actually, there's a new field of surgery called fetal surgery where we're operating on babies while they're still in the wombs. We don't do that surgery here, but we still have the capabilities to operate on very, very small premature babies.
Dr. Feltis says his attraction to surgery came from the ability to be able to offer a full range of treatment to his patients.
And I specialized in the field of pediatric surgery for that same exact reason, because now within the field of pediatric surgery, there's not a lot of other subspecialists, so we can operate in the thoracic cavity, we can operate in the abdominal cavity, we can do complex corrective procedures for newborns.
Feltis began his medical career in Minneapolis, and he was recruited to ETSU Health to help provide broad-spectrum care to the children of rural Appalachia.
And it was a position that really appealed to me at this point in my career. I've been here for almost 3 years, and I've been really excited about being here still.
I know you're excited to be here. Talk about this area. What I know your mission drew you here, but once you got here, what about this area has really spoke to you? What do you really like about this area?
Well, many things. First of all, the patients that I have the privilege of taking care of, the sense of community and the sense of family is really, really strong here. We love being able to provide a service here so our patients don't have to drive 4 or 5 hours to a bigger city, and that really blesses me to be able to provide that service.
With a wife and 5 children, Dr. Feltis says that his family is definitely one of the most important driving forces in his life.
Yeah, well, my family life is super important for me. My kids keep me humble, as a kid should be. I'm super proud of all of them. They're all very bright. Parents like to brag about how bright their kids are. Interesting, none of them are really into outdoor activities. They do like hiking with me around, but they're all into more cerebral activities, fun games, family games, stuff like that. But no, we have a super strong sense of family, and I was really excited. All of my kids decided to move here with us. My 2 daughters go to ETSU. I have a son who's at graduate school in Knoxville. Another son who's a local teacher here, teaches high school math. And then my other son is in Chicago in graduate school, but he loves being here as well.
And back on the professional side of things, Feltis says that providing pediatric surgery locally is vitally important to our region.
It is vitally important for us, it's vitally important for ETSU Health and the mission that we want to be the go-to provider for these services in the area. And again, we really want to keep the people, because even the people in our catchment area, they still might come 2 hours just to get to. So it's one of our highest priorities. Our pediatric service line through Ballad Health and ETSU Health is to be able to provide pretty much everything that they can get either at Vanderbilt or in Knoxville. There's just a couple things that we're not able to provide, but the vast majority of them we are.
Last question. When you see that small child, or that child that you perform surgery on, leave the hospital and the outcomes are good, how much of a sense of accomplishment and pride do you have there?
Yeah, matter of fact, I'm just getting chills thinking about it. It's the absolute favorite. I can't imagine a better feeling in the world other than being able to take care of a sick child and have them go home with their parents. And so I'm thankful that I get to see that scenario play out multiple times a month, and every one of them is my favorite memory.
All right. Great conversation. Thank you, Doctor.
Thanks for having me.
Dr.
You're
Brad
welcome.
Feltis, this week's Meet Your Provider with ETSU Health. The preceding portion of Daytime Tri-Cities was sponsored by ETSU Health.